We will get this.
We will. I think we're recording now. So I'll say, hi, Donna, we're ready. We're recording.
Okay. This is Donna McDonald from the MHE Coalition. I'm the treasurer. Recently, well, about a year and a half ago, I took over sending out the packages that you guys get for different reasons. I live in Kentucky, and I live in a remote part of Kentucky. So my internet went down. So Annise and I are going to wing this. We're going to hope that this works. We're joined by Dr. Annise Nadrick, and she's got a wonderful, wonderful background, and she's going to talk a bit about non-narcotic pain management. And I'm going to kind of join in with her. I'm an ICU nurse, have been for more years than I want you all to know about. But anyway, we're going to talk about, this is probably our biggest topic within the coalition, and the biggest thing people want to discuss. So I'm going to turn it over to Annise, and we will see where we get
Wonderful.
to.
Wonderful. Well, thank you. Donna and I have talked about this a few times, about how we wanted to get information out there and share it, because it is one of the biggest concerns when you have a rare condition that's not well understood, maybe by lots of doctors that you come into contact with. And when you're the advocate, so Donna is the advocate, of course, for all of us, but also for her. You have been for your husband, for your daughter, and now for your granddaughter. And for me, for my mother-in-law, and for my husband, and for my son. So the two of us, while we have professional backgrounds in helping people with pain and clinically working with people, we also have this dedication to helping our family members to be comfortable. So I am a chiropractor. That's my background and training, and also a self-proclaimed nutrition geek. And so in my area, I don't have any professional background in opioids or prescription medication. It's outside of my license. However, chiropractors are very good at alternative pain medication. And so I have been studying and immersed in natural or alternative pain relief for over a decade. So, and I'm so glad to have Donna here with her expertise in the ICU, because while opioids and narcotics are effective in their pain management, we have 11 million people who misused their prescription opioids in 2017. So the last day that I found data for is 2017. So we know that in 2020, it's absolutely not getting better. We also know that the non-steroidal anti-inflammatories, so Motrin, things that you can buy at the grocery store, also have an increased cardiac risk. So even though you're using sort of traditional pain management, it's not without risk. So it's just a good idea to have lots of tools in your toolbox when you're dealing with discomfort and with pain. So there's two things that I want to talk about today. And that is some tips for you to get better outcomes when you're discussing pain with your healthcare providers. And then the second thing is home remedies for pain. And Donna and I talked again, so this presentation is going to focus on, non-narcotic solutions. So there's certainly a time and place for those things, but we're going to talk about not using them or avoiding them, using them sparingly, give you more things in your toolbox. So we'll start with how to get a better outcome with your healthcare practitioners when you have pain. So this gets discussed a lot in the Facebook group, people who experience doctors who discount their pain or don't believe in their pain, it just gets discussed a lot. So the first thing is, I just want to sort of validate everyone's feelings in that doctors give patients approximately 11 seconds before they interrupt you. So if you feel like, I went to the doctor, I tried to tell him my shoulder, my knee, my hip, whatever is hurting, and I just don't think they heard me, that's pretty common. Unfortunately, our healthcare system is challenging, and the doctors are in a rush, for things that are outside of all of our control. But a lot of doctors, anyway, the average is 11 seconds. So what I would like to do is give you some tips on how to be really efficient in those 11 seconds before you get interrupted. So So the other thing I want to just say is, like, your story is valid, right? The thing that you need to say to your doctor about, I have MHE, you might not know exactly what that is. I've had this pain, it's been going on for months. You have this story that you've been thinking about, and it's important and it's valid. It doesn't always fit in 10 seconds, 12 seconds, 18 seconds, whatever it is before you're going to be interrupted. So again, these tips, I want to just, again, validate all of your concerns. My tips here are to help you condense what you need to say before you get interrupted. So the first thing that you want to do is to make sure that when you are telling your pain story, that you use a severity scale, that you use objective words, and I'll talk a little bit about that more. And then also what makes it better and what makes it worse. So those are the three things that you want to make sure you communicate about your pain to a doctor or a healthcare practitioner. That could be obviously a nurse, it could be a physical therapist, it could be your chiropractor. So you want to make sure that you're saying those three things. That's how to describe pain. And the reason that's so important is because pain is subjective. So everyone experiences pain differently. Doctors have no magic way to know that when you walk in and say, I am really hurting, that is any different than someone else who comes in and can hardly breathe, can hardly speak, they're crying. It's just, they see all day long, all different people present all different ways with pain. So the way that you can describe the pain for you is in a more objective way that's giving them more details, rather than subjective, which is everyone feels pain differently. So the first thing is a severity scale. All healthcare practitioners use this specific 0 to 10 severity scale. What I would like to tell you is there is no 11. There's no 11. So this is the scale, 0 to 10. And I can see Donna kind of shaking her head, like, this is nurses, doctors, pediatricians, physical therapists, anyone that has a license. We're all taught this same scale. And that's so that when you tell me it's a 4 or an 8 or whatever your pain is, and you go to the emergency room and you tell them what number it is, that all of us as healthcare practitioners, we can refer a patient or use a patient and give the care. It can be consistent because all of us understand what that level of pain means in severity. So this is available on the internet. I just grabbed this one because I like the colors that are in it, but you can go and look at this and decide what your severity of pain is before you go talk to your doctor. So you already have it in your head what that number is. Again, there is no 11. So as soon as a patient, little tip, it's like the little secret here. If you say 11, healthcare practitioners are like, come on. They're almost not going to believe now whatever you say next because there is no 11. So 10, number 10, if you see in there, it says unable to move. Pain is so bad you can't move, you can't speak usually. This is call the ambulance. The ambulance has to come get you. No one can understand you. You can't move. The pain is so horrible. So if you say my pain is a 10, again, 10 is usually so bad you can't communicate, you can't move, you need someone else to take over, okay? And there's no 11. So even 10 is really like, let's not even use 10, okay? So if you are walking into the doctor's office, if you're speaking, if you're functioning, you're not gonna use 8, 9, or 10, probably. You might, post-surgery, you might. So really, 0 says I have no pain. 1 is it's hardly noticeable. 2, I have some pain, but I'm able to distract myself. 3, uncomfortable. My pain bothers me, but I can ignore it, okay? 5 is it's distracting. It's distracting. I'm at work, I'm trying to focus, I'm with my kids, I'm trying to do something, but I'm aware of my pain. It is distracting me from my life, okay? 6 is distressing. So a 6 is enough to go to the doctor. 6 is enough to go to someone and be like, I'm upset. My heart is beating. Something's wrong. My pain is, something is wrong. Number 6. That's a 6. I know I'm harping on this. As a chiropractor, I have so many people come into my office and they're like, oh, how's your low back pain? Oh, it's an 8. And I'm like, I watched you carry your kid into my office, get out of your car, close the door. Like, there's no way it's an 8. You carried your kid. So anyway, I'm trying to explain to you how to be more effective when you talk with your doctor. Okay. 7, unmanageable. 7 is, I've put a hot pack. I've used an ice pack. I've tried doing a different position. I've taken a walk. I've tried all the things and it's not changing. Okay. And then again, 8, 9, and 10 is really like emergency room visit. Okay. So anyway, severity. I feel like I talked a lot about that, but I think it's really important because if you communicate that effectively to your healthcare practitioners, then they're listening now because they're like, okay, you're listening. So you could use those words. Yeah, Donna, what do you want to add?
I'd like to add, if I walk into a room and somebody says their pain is a 10 and they are texting on their phone, I have a couple of not very nice thoughts about that. So just so you know, well, one thing that I immediately think of is that you're a drug addict.
Right.
So keep that in mind. Now, I'm not saying that everybody who has a 10, I mean, there is such a thing as a person with a 10 pain.
Yes.
I have seen it, but they are not texting on their phone or playing a video game. Just saying. That's just my input.
Thank you. Thank you. So that's going to be your severity. The other thing is this sentence. So this is that sentence that's going to help you get your pain across to the doctor in that less than 11 seconds. So for example, this is just going to give you kind of some examples. So like, the pain in my shoulder feels like a sharp stab. It's a 6 on a scale of 1 to 10. The pain is distressing. So you want to use that like one word that goes with the number. It's a 6, it's distressing, okay? Because you want to let that doctor know that you understand the pain scale, okay? Because of this pain, it's hard or nearly impossible to raise my arm up, carry my purse, open the milk, okay? So again, activities of daily living. So you want to add, it's hard or nearly impossible to, and then list what those things are. If it's type for work, if it's hold the phone, if it's pick up my child, whatever the activity is, sit down on the toilet, whatever activity is interrupted by this pain. Because this tells the doctor, I have pain, I know how to qualify my pain, and it's interrupting my life. Because again, now you've made your pain objective, not subjective. Ouch, ouch. Because ouch is okay, but ouch is for your mom, ouch is for your grandma, your friend, ouch. Because it's okay, we're gonna give you what you need as a caretaker. But for a healthcare practitioner, they need the objective understanding. Okay, because then they're gonna filter through their brain like a puzzle. Okay, what's wrong with this person? How many things could be wrong? They're filtering. What diagnosis is this? What do we need to do? Do we need an x-ray? Do we need an MRI? What do we need to do? So the doctor is filtering that information. And so you want to give them information that helps them to filter to a helpful outcome. So this is a statement that you can practice and get ready for before you go to the doctor. The pain in my, state the area, it feels like this. Give it a feeling, which is burning, achy, sharp. You can look this up on the internet, words for pain, words that describe pain. I have a whole word bank of them that I use. And if you would like that, you can send me an email and I'll email it to you. But you can use this word bank. So describe your pain. And then it's a 6, it's distressing. It's a 5, it's whatever. You can use a word and a number. And then because of this, it's hard or nearly impossible to, and then list the things in your life it's hard to do. So I'm going to give an example that we have recently. My husband's been having knee pain related to MHE, and keeps being dismissed by his doctor. They keep telling him, it's fine, it's fine. But we got to the point where he said, because he was finally able to articulate, once I walk more than, I forget what it was like, we had to measure the distance, but it was like, once I walk more than 20 steps, my leg hurts, and by the time I get into my office, my leg has fallen asleep. Aha. Now the doctor can say, okay, that's not a typical, like, I overused my knee, right? Like, now we're getting into MHE land, right? And I know everyone listening is like, yep, I know that pain, right? But now we've turned it into objective. So it's not like it's just annoying. It's to the point where we've said he can't walk more than 15 or 20 steps. And how many things are 15 steps away? Like, everything is more than 15 steps away. So once you can be that specific, you're more likely to get the treatment that you want. Okay, I think that's the end of how to get a better outcome with the doctor portion. I could be wrong. Oh, what makes it better and worse? So what makes it better and worse? That's the only thing, just once, that's easy. What makes it better? Putting my leg up, standing up, sitting down, heat, ice, you know, again, what makes it worse? So that's when we got to the walking more than 15 steps with my husband is the thing that makes it worse. I think it's like standing for him right now makes it worse, but sitting isn't very much better. Laying down is helpful. So again, these are again, those like activities of daily living that help a doctor filter through what muscles, what nerves are involved in that specific pain, when you can tell them what makes it better, what makes it worse. Be as specific as possible. And I think that's it. So that's that severity rating of 1 to 10. Activities of daily living that are impacted, and what makes it better and what makes it worse. So practice saying that sentence and take notes. You can even write it in your phone, you know, on your notes app, or like I usually write it in our calendar when we have the doctor's visit. In the notes section of the calendar, I write that sentence. The pain in my blah, blah, blah feels like this. It's a this scale. This makes it better. This makes it worse. So you write that. And so when you get in there, you can say that sentence before 10 seconds. And that helps you get focused attention. So I hope that's helpful. I hope that gives you some insight in having a better outcome with your healthcare practitioners. And then we'll get to part, yeah, go ahead.
I think what I will do is I'm going to put some of this in the We Care and the Bumpy Bone packages. I'll also, well, this presentation is going to end up on YouTube for everybody. But I think I love that pain scale. I've never seen it before. I love it. So I think I'm going to use some of that in some of the stuff we send out, if that's okay with you.
That's great. And I'm working right now on writing a workbook. So I have some workbook pages that are started. And so I'll work on sending some of that you can easily get out to folks that can use it.
Yeah, I think if we could incorporate it into our Bumpy Bone tracker, which I don't know whether you've even seen it.
It's very good.
Yeah, I think if we could, but it's loose. For me, it's loose. I think if we could tighten that up, it'd be great. Okay, I got off track.
That's awesome. It's awesome. So, okay, you've gone to the doctor, you've explained everything really well in your 12 seconds, and it still hurts. So now what do we do? So this is where Donna and I have really been talking about, you know, how do we help people just really almost like brainstorm other things besides narcotics that will help. So this is my list. This is not an exhaustive list. I've actually already thought of like 10 things that I forgot to put on this list. So I think, and we're not even going to read it to you. You can see it. The slide is there. But I think Donna and I just want to talk about a few of these things. If you've never heard of something on this list before, then you could just put it on your list of like, I'm going to look that up. I'm going to see if I can find some of that at the grocery store. Try it. This is just an experiment. Not all of these things work for everybody. However, everything on this list, specifically this list, is research. There is research behind it that it is effective for pain. Some of the things on this list are as effective as narcotics in the research. So this is not just things that we are trying to, I think sometimes it can feel that way when you're in a lot of pain and people say, well, have you tried a hot bath? And you're like, are you kidding? Like, I really hurt. And you feel like it's almost offensive, right? For somebody to tell you something. But what I want to say is the things on this list really are research effective. So please try it. Try it a few times before you decide it doesn't work. Okay, so some of the things that are on here, just, easy, heat and ice. Okay, so I already said I promised you I won't read the list to you, so I won't read the list. So a couple things I wanted to just talk about on here, and that is CBD, THC, and turmeric, because the research on these things is fabulous. I think people know about them, they've heard about them, but I just want to add a couple of points, which is CBD is one part of hemp from the hemp plant, and THC is part of a similar plant. But what I want to say is those are parts. And so if you can get access to the whole thing, if that's legal where you live, if you can get access to the whole thing, or if you can find something like this is a nutritional supplement. It doesn't matter the brand, but there are some nutritional supplements that are hemp oil. And so it doesn't have THC in it, but it has parts of the hemp all together. So it's kind of like, apple flavor and eating an apple and apple pie are all kind of an apple, but you get the health benefits from eating a real apple. Okay. So kind of the same idea with hemp oil, it can have the parts in it that are cool, but when it's all together and you get the whole thing, there's more benefit. So just kind of put that little plug out there. Also, if you're in a place where there are legal issues on these things, CBD is legal in all 50 states. Currently, it always changes, but double check your state. But CBD is legal, it's safe. It does not make you high. It doesn't, it can't. But what I want to add is that 20 to 25 milligrams should be effective. The other thing about CBD is that a lot of I have family members who are like, I tried CBD, it doesn't work. What I'd like to encourage you to do is try it every day for 2 weeks. So whether you're using an oil or a capsule or whatever with CBD, try it every day for 2 weeks before you say it doesn't work, because the research on it is fabulous and it works for most people. So just try it differently. You could try a different brand. You could try a different delivery system. Sometimes that's helpful. So THC is legal in lots of places now. And again, it has a wonderful modulating effect for pain. And you can talk to, especially if you have a pharmacy where you can talk to experts about these things, there are ways to take THC to help with pain management that don't make you high, for real. The technology, the growing, all of that has come leaps and bounds. Every time I read articles on it, I'm so surprised at how far it's come. So I just want to kind of put that out there, that there are ways that it can be, I don't want to say safer, but just different. It can be different. Okay, and then turmeric. I want to talk about turmeric because I have so many people tell me, oh, I tried turmeric. And I'm like, well, how did you try turmeric? Oh, I would shake it in my coffee or I'd sprinkle it on my food. Okay, that is not enough turmeric for pain management. It's just not. So this is a turmeric one. This is Gaia Herbs. You can get this at health food stores. It's not very expensive. I just like this brand because it's nice and clean. This one is specifically for pain. So you want to have like 20 to 30 milligrams of curcumin, which is the active phytochemical in turmeric that makes it a pain reliever. You need at least that much. So it's awesome if you want to sprinkle some turmeric in your food, please do that. It has wonderful antioxidant effect. So if you use a low dose of turmeric, antioxidant. If you use a moderate, it's an anti-inflammatory, which means it's going to affect pain. And if you use a large amount of turmeric, it's going to have an immune modulating effect. So you want to be in that medium dose. And so again, you want something like a capsule that's very specific for pain, not just like drinking golden milk, which please feel free to drink golden milk. It's super great for your heart and lots of other things. Okay, so that's those two things again, I just like to put out there. Also taking it every day for 2 weeks. So that's, a little bit there. I'm trying to think if there's anything else I wanted to be sure to say. Um, those were the things I wanted to highlight. Jonna, what do you want to add?
I'm really into guided imagery. I don't have MHE, but I do have chronic pain. I have migraines. They're severe. But I like guided imagery, meditation. I also love TENS units. I mean, that's probably been my godsend as a nurse. Also, acupressure I use quite a bit. But in my practice, those are the things that I use for me. Now, in my practice, I use guided imagery, like if I'm having to do something unpleasant that I know is going to hurt. We go to a night, I ask them where their favorite vacation spot is. Let's think about that. Let's visualize that. And before you know it, I've got an IV in. Distraction is another one. Especially with confused patients, if you can distract them in talking about maybe not what happened yesterday, but what happened 50 years ago. I find that really, really useful. So that's just some of my nursing practice sorts of things and some of what I use. I also use Epsom salts baths a lot. Currently, I'm actually using an Epsom salts bath with hemp in it.
Mhm.
So, I mean, that's, and a soap that's got hemp and tea tree oil in it. So that's just some of the things I'd like to add. I kind of jog around all kinds of things, but
Well, and
those
I
are
think
some.
that's helpful too, is changing it up, because our bodies do get used to things. And so trying, different things. And I want to support what you said with research, and that is meditation and guided imagery is as effective as narcotics in the research. I don't
Yeah,
think people understand, so when a doctor or somebody says, have you tried meditation? I think patients get offended. Like, you think this pain is all in my head? No, I don't. Your pain is real. Absolutely. However, the power of meditation, the power of your brain, the power of guided imagery is extremely strong. It's as strong as narcotics with no side effects. So please don't be offended when people suggest guided imagery or meditation, because the research supports it.
Biofeedback is another really good way. I had daily migraines, so I've been through a lot of different things to help, but they taught me how to lower my heart rate, my blood pressure, and my temperature through biofeedback. And I mean, that can really be effective, but you have to be trained to do that. Meditation and guided imagery, you can kind of pick that up on your own, and that's why I really like those two. So
Yeah, and even kids, kids are so good at it. They don't, I think for me, it always takes me several minutes before I can relax. But kids, they're just right there. They can just immediately. I mean, they're magic. Their little brains are magic. And there's all kinds of wonderful apps. And I feel like my kids respond really quickly to apps. So to me, it's not my favorite to meditate with an app, although I've tried it. It's awesome. But the kids love it. They just turn that on and can go with it. It's amazing. So there's lots of ways to try meditation or help with guided imagery if it's not something you've done before.
right, and I'm sending out like meditation templates in the bumpy bone packages now, along with the worry stones, because that's a good one too, is using the worry stones. So I'm trying very hard to include in the bumpy bone packages some things for parents to try with their kids that are not drugs, because who wants their kid on drugs, so.
Yeah, it's a struggle. It is a struggle. And that's so wonderful. And of course, we all appreciate that, because if you haven't tried it before, it's so nice if it comes in the mail and you say, okay, we're going to give this a try. You know, Miss Donna sent it and we're going to give it a try. So I hope that folks are doing that, you know, giving things, trying a new thing. And I think actually that might be my next slide is, you know, post in the Facebook group. Let us know what you've tried, how it's going. Oh, here's just some little facts there. Just trying to give you some extra facts about that list. Because I think sometimes people don't know, you know, well, why are we using it? You know, why are we using acupuncture? Why is, you know, why do we use these things? So there's just some little tips. And then I think it's coming up, maybe the last slide there is to post. Oh yeah, so we talked about this, trying something for 2 weeks. So, you know, make sure if you're trying the CBD or the turmeric especially, you know, try that for 2 weeks. But also, you know, make sure you're taking a therapeutic dose. So sometimes a friend tells you, oh, try cinnamon, try ginger, try whatever. But you could look it up. It's pretty easy, especially through, you know, internet search, to find out what is a therapeutic dose, what's used in the research to achieve pain modulation. And so, and then take that amount. So for example, you know, a long time ago, it was popular, everybody was talking about fish oil. You know, that was like the thing for a while, was fish oil. And there was this great research on depression, how fish oil affected depression. Well, unless you read the study, you didn't know that you had to take 8 to 10,000 IU a day in order to get the antidepressant results. So everybody's out there at Costco taking one capsule and going, oh, fish oil it's not helping me with the antidepressant. Well, you need 8 a day. That's the therapeutic dose. So, you know, same thing with turmeric. You need the 25 to 30 milligrams of curcumin. You can't just shake the turmeric on your toes. So anyway, so make sure you're taking a therapeutic dose, and then also make sure you try it for a few days. You know, one dose it is not enough to know for sure if it's going to work or not work. And that's true for a prescription as well. And then once you try something, post in the Facebook group. You know, there's so much chatter there. And so if you try the guided imagery, or if your kid loves the Worry Stone, or you try the Calm app, or, you know, you try the turmeric for 2 weeks and it works, I would love to hear that. You know, it'd be great. Post that in the group. Or if it doesn't, you can say, hey, I tried turmeric, it didn't work. You know, what else? What else do people recommend? It's just a great way to encourage all of us to try something new.
Okay. I think we got to the end of our slides. I think we did. I think that's a wealth of information in a short period of time. So I'm hoping, and I want to encourage everybody to share anything they find that works, because like you said, what works for one person may not work for somebody else, but you also have to give things time. Like an Epsom salt bath, you cannot get in it for 5 minutes and have it do anything. 25 minutes, you know, till the water's cold.
That's right. That's right. Till the water's cold. That's exactly right.
So, all right. Well,
I'm gonna pause our recording and just say thank you.
Thanks, everybody.
Thank you.